And welcome back to the show. In late 2022, Governor Kathy Hochul announced more New Yorkers will actually be eligible for financial assistance in 2023 through the expanded Medicare Savings Program. Now, the increased income eligibility limits will help older adults and individuals with disabilities actually be able to pay for healthcare costs. And joining me now and sharing more details, we've got the Assistant Vice President, Head of Medicare Markets at Healthfirst, Abby Maitra. And Abby, glad to have you with us. Talk to me a little bit about where we are right now. Obviously, this expanded Medicare Savings Program will be quite beneficial to a lot of people.
Yeah, good to be here, Darren. Thank you for having me. Absolutely. It is a monumental change this year, starting in 2023. Hundreds of thousands of more Medicare beneficiaries, so these are seniors and individuals with disabilities, are going to qualify for the Medicare Savings Program, which is significant and a big deal, as you mentioned. And this program is really critical and vital. It can save a Medicare beneficiary up to $7,000 a year. So super, super important to help get the word out that this change has happened, and many more seniors will qualify for the Medicare Savings Program in New York.
So, Abby, let's do this for our viewers who may not be so familiar. Let's roll out exactly what is the Medicare Savings Program and how does it work?
Great question. The Medicare Savings Program is a program to help Medicare beneficiaries that are living on a limited or fixed income and it helps to pay for their healthcare costs essentially. So helps to reduce the burden of paying towards Medicare. So it's very important that many more seniors understand this program and the benefits of the program. And there are multiple benefits of the Medicare Savings Program. One is that it helps to pay for your Part B premium. So, for our Bronx residents out there, our seniors, individuals with disabilities on Medicare, if you have a Part B premium, that $165 that is taken out of your Social Security check every month in 2023, this program will cover that. So, it essentially puts back $2,000 in your pocket a year, which is huge and significant. The other major benefit of the Medicare Savings Program is that when you qualify for the MSP, it automatically enrolls you into full extra help. And this is a federal program that helps to pay for your Part D prescription drugs. So when you qualify for MSP, you're automatically enrolled in full extra help, and it helps to lower your prescription drug costs. You'll have a $0 deductible, $0 coinsurance towards your Part D expenses, which is huge. And that is estimated to save a senior about $5,000 a year, which is significant. Another important benefit is depending on the MSP that you qualify for, you can have cost sharing expenses covered for the Medicare services that you have, which is really important. So essentially helping you move into a plan that is a $0 out of pocket expense for you. The other additional benefits of a Medicare savings program are, if you have a late enrollment penalty right now on Part B or Part D, well, having an MSP eliminates that for life. Also, if you don't have Part B from Medicare yet, this program helps you to gain Part B from Medicare. So there's multiple benefits of the Medicare Savings Program, but as I mentioned, the major ones is it covers that Part B premium, that $165 a month. It helps to lower your prescription drug costs. And it really can help with cost sharing if you qualify for a specific MSP. So overall, as I mentioned, an average of $7,000 in savings a year that can be assumed by enrolling and qualifying for the Medicare Savings Program.
So we know that these changes are coming to the program. We know a lot of things are available to the actual person that takes advantage of this. Can you share with us a little bit about what you're doing in terms of rolling it out, getting it out to the public? I know there's some awareness that's going on, and talk about how you guys are really engaging in the awareness to make people more cognizant of these changes and also what's available to them right now.
Yeah, sure. And before we dive into there, I would love to share how you qualify for the Medicare Savings Program. So one is you already have to either have Medicare Part A or be eligible for Medicare Part A. And the second, it's, eligibility for the Medicare Savings Program is based on your gross monthly income that you bring in. And so right now the thresholds are if you're single and you make $2,300 a month or less in gross monthly income, you may most likely qualify. If you are married and you make $3,000 or less a month in gross monthly income, you most likely will qualify as well. So these thresholds have expanded significantly. Thousands of Bronx residents, seniors today, most likely qualify. So very, very important to get screened and qualified and enrolled in the MSP program. So what is Healthfirst doing? Great question, Daren. So thank you. We are, the largest dual plan in the region, fifth largest dual plan in the nation. We are very committed to the populations that we serve, especially our dual members. These are members that qualify for both Medicare and Medicaid, that are living in New York on a fixed and low income. So it's very, very important to us to help get the word out that this big change has happened this year. You may qualify now for the Medicare Savings Program, and you're going to get a lot of assistance helping to pay for your healthcare costs. What we've done at Healthfirst is we have set up a dedicated team. These are specialists that are trained in the Medicare Savings Program. They can help screen you and enroll you, hold your hand along the way. You can do it over the phone, or you can come in person to our Bronx CEO or all of our other CEOs across New York City. We have many different locations. Please come in, get screened, and see if you qualify. This team is brilliant. They're trained in collaboration with the Medicare Rights Center in New York, and they can really help to understand if you qualify and get you into the Medicare Savings Program. And, we are doing our part, getting out there in the community, making sure that our own Healthfirst members are aware that this change has happened and they can qualify. I'd love to give a shout out to our Bronx Healthfirst members. There are 6,000 Healthfirst Bronx members today that qualify for a Medicare Savings Program. So you are paying more than you need to. So if you are a Medicare beneficiary watching this today, or a child of a parent that has Medicare, really, really important to see if you qualify for the Medicare Savings Program. And Healthfirst is here to help you do that. As I mentioned, we can help you over the phone, or we can help you in person. So we're doing everything we can and working very closely with the Medicare Rights Center to get the word out and increase the MSP adoption in New York. A statistic I want to throw out, which is really important, is that only 40% of those that are eligible for the Medicare Savings Program in New York actually are enrolled in the MSP. So there's a huge opportunity for more seniors to get enrolled into this vital program. And we have a moral obligation here at Healthfirst. We are mission driven and committed to ensuring that seniors have access to affordable health care, and really important to get the word out on the Medicare Savings Program.
Well, Abby, it is some vital information that we want to make sure that our viewers get. And thank you for taking the time to really share, because I think it's important that we also know who's eligible, what these benefits mean, what these changes actually mean, and how a person could actually be involved. So thank you so much for sharing with us, and we're glad to have you here on Open.
Thank you so much, and thanks for having me, Daren.
All righty. Well, for more information, we encourage you to go ahead and visit their website at healthfirst.org, and then also follow them on social media at HealthFirstNY. We do have more Open coming up. Don't go anywhere. We'll continue right after this.